Chapter 1, Phlebotomy, Past, Present, and the Healthcare Setting. Today we're going to spend some time running through the different parts and pieces of the laboratory and some of the characteristics of a person it might take to work in the medical laboratory setting. All right, so let's go back and take a historical perspective on phlebotomy. So this goes all the way back to the Stone Age, where crude tools were used to cut vessels and drain blood from the body. Up through Egypt in 1400 BC, we can see that tomb paintings showed leeches applied for patient bloodletting. And Hippocrates in 460 to 377 BC, we noticed that there was four humors in the body: blood, phlegm, black bile, and yellow bile. They thought those were the four liquids within the body. Bloodletting was often used to remove excess humor. They would also do venisections, which is cutting the vein to bleed the patient, as they believed that if there was illness within the body, that if they let the blood out, it would release the illness that was making them sick. In the Middle Ages, we used the barber surgeons, which were haircutters and surgeons, would perform bloodletting and leeching. The barber pole, red and white, represented the blood of the patient. They would also use a bleeding bowl to collect the blood from the patient, as shown in the bottom right-hand side. In the 17th and 18th centuries, phlebotomy became a major therapy. They used lancets and fleams to cut veins and arteries, and cupping and leeches were also used. The process of cupping, involved the application of a heat suction device and multiple incisions of the capillaries. So they would cut the patient and provide a suction device that would pull the blood from the patient. The blades were often wiped clean with a rag and used from patient to patient. Fleams were also used for general phlebotomy to direct access and open arteries and veins to remove large amounts of blood if needed. So here's an example of some leeches. They would place a drop of milk or blood on the patient's skin to entice the leech to the patient's location needing bloodletting. To introduce Hirudo medicinalis to the site, that injects a local vasodilator, a local anesthetic, and an anticoagulant. So the leech provides all of those things on the patient. The leech will then engorge and fall off. Now, this might sound kind of weird, but we actually do use this in today's medicine. I've seen it in patients that have wounds that won't heal. They will put the leeches on, and it will help pull fresh blood to the site to allow, a better blood flow. So, where are we today? Our goals for today is to obtain blood for diagnostic purposes and minor treatment. We remove blood for transfusions at a donor center, and we also remove blood for therapeutic purposes. There are some people that make too much blood, so we do need to remove the blood so that they don't have too much. Some of the methods include venipuncture, which is a blood collection via a needle inserted in the vein, or capillary puncture, as seen on the bottom right, where we puncture the skin and collect blood that way. So what is the role and skill of a phlebotomist who will be drawing the blood? Well, a phlebotomist is anyone trained in blood collection. Many healthcare team members are actually trained in phlebotomy, not just phlebotomists. We have medical assistants, phlebotomists, medical laboratory technicians, anesthesiologists, etc. So the skill and knowledge or competencies that are needed include having good manual dexterity, okay, so you have to use your hands. Good communication skills to talk to the patients and the physicians and nurses. You have to be organized. Sometimes you have to draw blood from several patients all over the hospital. Thorough knowledge of lab specimen requirements. You can't just draw some blood and bring it down and expect the lab to use it. You have to know the different types of requirements for different types of samples. You have to have training in phlebotomy skills and standards of practice. You have to have excellent customer service skills and a thorough understanding of scope and standard of care. So, phlebotomists will find that when dealing with patients who are ill or irritable, a confident and professional appearance will be most helpful to them doing their job. Sometimes they require certification. So certification for a phlebotomist would be a document or recognition granted by an agency. It requires completion of a defined academic training requirement. It requires attainment of satisfactory score on a comprehensive evaluation. Sometimes it's required by a facility or employer. The test that you can take to be certified is the PBT, which is the phlebotomist test, by ASCP, which is the American Society of Clinical Pathology. Most employers do not require the exam to be taken, but do find it desirable and would be more likely to take a candidate who has taken the certification exam over one who has not. Licensure. So a license is an official document that permits you to work within a certain state. In some states, it's required by law. Wisconsin is not a licensed state for phlebotomists and lab techs at this time, but it may change in the future. So it requires specific education, experience, and passing an exam as well. I know some big certified states are like, our licensed states would be like California, Florida, New York. Continuing education is usually required by certifying and licensing agencies as well. So after you take the test, you're going to have to do some additional education to keep that certification. Phlebotomists are also involved in customer relations. So a phlebotomist may be the only contact or interaction the patient has with the lab. So you kind of are the middleman. A patient may judge hospital based on the encounter with the phlebotomist. The goal is to put the patient at ease and establish a positive relationship with that patient. We also have to understand diversity. We have to understand that people have different beliefs and values. Some religions do not want their blood drawn ever. We need to value that. They have needs based on their environment. There might be customs and traditions that are different to different people's beliefs. And attitude towards keeping people or seeking help from healthcare workers kind of depends on people's backgrounds as well. So what are the qualities of professionalism? We need to maintain a professional appearance. This is really important. Your scrubs need to be clean, free of animal hair. They need to be, I don't want to say pressed, but definitely free of wrinkles. You have to be self-confident. You have to have integrity. You can't just not show up for work because then there's nobody to get the blood draws from the patients. You have to be compassionate. People are in pain. When people are in pain, they can be kind of crabby. So you have to just be compassionate with them and understand that it's not you, that they're just not feeling well. You have to be self-motivated, be dependable, and have very ethical behavior. I treat every single patient as though it could be my mom or one of my children. All right, so patients' rights. There are 2 documents published to strengthen consumer confidence. The first one is the Patient Bill of Rights in Medicare and Medicaid, and then there's the American Hospital Association's Patient Care Partnership. It's been found that patients who are informed about their treatments and prognosis are considered in the decision-making process are more satisfied with their care. The American Heart Association's Patient Care Partnership is a plain language brochure that informs patients about what they should expect during their hospital stay with regard to their rights and responsibilities. It ensures high-quality hospital care, a clean and safe environment, involvement in their care, protection of their privacy, help when leaving the hospital, and help with their billing claims as well. The next important piece is confidentiality. I cannot tell you how important this is. Patient information must be kept private and confidential. Ethical standards and laws enforce this. How many times have you been to the doctor's office and asked if you wanted a copy of the HIPAA brochure? The HIPAA brochure comes from the Health Insurance Portability and Accountability Act, called HIPAA. This safeguards confidentiality of protected health information. It established national standards for electronic exchange of public health information and protected health information, It states that patients must be informed of their rights and requires a written authorization. So you can't just go to the hospital and get anybody's health records. Actually, it's really difficult to get your own unless you fill out a form. The most important thing is if you are working in a hospital as a phlebotomist and you see Sally Sue on one of the floors and her HIV is starting to turn into AIDS, you may know her from high school, but you cannot tell anybody that you saw her or know of this situation. Confidentiality is very important. Just think, if you were in the hospital, you wouldn't want people telling everybody that you were there either. Communication skills are important as well. So this is the mean by which information is exchanged or transmitted. There's verbal, active listening, and body language. All of these are equally important. We talk about kinesics, that's the study of nonverbal communication, so facial expressions, things like that. Proxemics, the use of space, okay, you got to give people their space, and appearance and touch as well. You can't be touching patients that don't want to be touched, etc. So there's a verbal communication feedback loop that is very important to understand. There are different barriers to proper communication. Sometimes culture, gender, emotions can get in the way, physical issues, age. There's all different types of things that can cause people to understand things or misunderstand things. So the elements of effective healthcare communication include empathy, which is kind of just understanding the other person, control, respect and confirmation, and trust. Listening is the foundation of good interpersonal communication. The phlebotomist is going to find that listening carefully to what is being said and watching for nonverbal cues is the way to quickly build mutual trust with patients. And sometimes I find, I work in a clinic part-time as well, and there's patients that come back regularly on the days that I'm working just so I can draw them. And they love it when you remember that one lady was headed to church for the Christmas musical to work with the children. So when she came back 2 weeks later, I asked her, how did the musical go with the children at church? And she was just over the moon excited that I remembered that about her. And I was able to have that communication. So even just little side communication like that just means the world to them. We have to have proper telephone etiquette as well. It impacts the quality of patient care, not just with patients, but also other people within the hospital. It's vital to efficient and effective service. Okay, so imagine that you're working in the lab and you just don't answer the phone. Okay, there could be a very serious situation going on in the hospital on the other side. You may also have a patient who doesn't feel very well and needs some information about lab hours if you're going to be open or something like that. There's only so much information we can give. But telephone etiquette is very important. You need to answer promptly, state your name and department. Hello, lab, this is Becky. Be helpful, prioritize your calls. Make sure you take in emergency room calls first, for example, or surgery. Transfer or put on hold properly, record important information. Know your laboratory's policies. I can't stress that enough. You cannot be giving patients results over the phone to random people that call and say they're a certain patient, okay? There's other ways to handle that, and they will give you information on how to do that. You can diffuse or de-escalate hostile situations, usually by listening is the best way to do that. If you don't know what else to do, just listen. Assist everyone and try and find the right answer. It's okay to not know, and it's okay to say, I'll get back to you with that information. So healthcare delivery, there's a couple different types of healthcare facilities within the United States specifically. You can have inpatient, which is a non-ambulatory or an outpatient ambulatory type of healthcare delivery. The 3 levels of healthcare in the United States include primary, secondary, and tertiary. Primary is general practitioners, your family doctor, so if you're going to go for your physical every year. Secondary include cardiologists, urologists, dermatologists, and other types of specialties. They can be in acute care or have short stays within the hospital, but it's usually very brief. Tertiary is where patients are admitted into these centers on the referral from a primary or secondary health professional. Tertiary health care is provided in a facility that has personnel that has advanced medical investigation and treatment per se. So that's where you go for surgery, or if you have your appendix taken out, or if you're in a massive car accident, like a big tertiary hospital. Ambulatory care is the medical care delivered on an outpatient basis. So there's patients that require care after discharge from the hospital. There's a couple different types of settings. There's freestanding medical care, okay, or hospital-owned clinics. If you're in the Appleton area, I think there's a lot of Theta clinics around, a lot of Theta Care clinics or Ascension clinics. outside of the large hospitals. There can be outpatient departments and even urgent care facilities where you might go for strep throat. An example of an urgent care facility is the one on the second floor of the health science building at Fox Valley Technical College. It's right around the corner. Some homebound services, patients' homes. They can actually stay at home nowadays and receive some care. And there's long-term care facilities. Another type is a public health service. So this is a part of the Department of Health and Human Services. Their mission is to protect and advance the nation's physical and mental health. So it sponsors and administers programs on the development of health resources, prevention and control of diseases, and it deals with drug abuse. Okay. It's constantly monitors, screens, protects, and educates the public against different things. And it provides services for little or no charge to the entire population when needed. Healthcare financing can be tricky. Everybody doesn't like to pay their medical bills, right? Because they're always so expensive. But there's different methods of payment. There's direct payment where the patient pays the provider. So you would just pay your bill. Or third-party payment where an insurance company gets involved. So you give the healthcare facility your insurance information. They bill the insurance. After the insurance is billed, whatever part they don't pay, you would pay the remainder. We use a lot of diagnosis and billing codes for insurance. So every lab test that is performed has a CPT code attached to it, and then a patient will have a diagnosis. If a patient comes in with strep throat, for example, their diagnosis might be JO 2.9. Then the CPT code for the strep test that we perform, I'm making this up, 12685, something like that. That code needs to correspond with that diagnosis or insurance won't pay for it. Okay? Diagnosis code and CPT code have to fall in line together. There's also Medicare and Medicaid reimbursement. For low-income people would be the Medicaid. Medicare is for people over the age of 65. We also have managed care. This is a payment system that attempts to manage costs, quality, and access to health care by detecting illnesses or risk factors early in the disease process, offering financial incentives for providers, offering patient education, and encouraging healthy lifestyles. So usually there's a set fee schedule, there's pre-authorization for certain medical procedures, and a designated case manager may be required in a complicated situation. So things that a case manager might do, they are the primary, usually it's a primary care physician and a gatekeeper. They're experienced healthcare professionals. They coordinate all of the patient's healthcare. They know the patient's conditions and needs. They know available resources and support and treatment. They advise patients on healthcare needs. They provide early detection and treatment for disease, and they refer patient to appropriate specialists when needed. We have different network service systems. So if you have ever had a full-time job that offered insurance, or if your next full-time job as a phlebotomist offers insurance, these are some words that you may have to become familiar with. So health maintenance organizations, or HMOs, are group practices, and they're reimbursed on a prepaid, negotiated, and discounted basis. So usually you have to use a certain hospitals and things like that. There's preferred provider organizations. So this is an independent group of physicians or hospitals. So if you have a PPO type of insurance, you're going to have to use a certain set of physicians. They exchange discounted services for a steady supply of patients with that one. There's also integrated delivery systems. So the number of different types of associated medical facilities may differ, and they can offer cost-effective, holistic, and coordinated care as well. So what are the characteristics of a hospital? Well, usually there's permanent inpatient beds. There's 24-hour nursing service. They offer therapeutic and diagnostic services, and there's usually organized medical staff that are available at all times. So hospitals are typically organized into departments or medical specialties. So what I have here on the right-hand side is actually a picture of what a laboratory might look like when you walk in the door. We're going to discuss each of these departments in detail, but as you walk into the laboratory, you will see various areas with people working and different departments. It's all in one room, but there's usually different tables and pods and analyzers and things. There's specimen receiving and processing. We'll have a hematology and chemistry department. There's usually a blood bank, a microbiology department, and some pathology within that as well. So here are some examples of some of the words that I just gave you. So the laboratory department has a lot of subspecialties within it. Usually there is surgical pathology where a patient has a tumor removed. Okay, there's a pathologist back there who's going to look at that tumor. You'll have various supervisors and you're going to have various departments. You're going to have a blood bank department, a chemistry, hematology, microbiology, flow cytometry. There's going to be urinalysis and coagulation within that as well. So all of these different departments will have people working in them providing laboratory testing and the results of that. So there's usually two major divisions or areas. There's the clinical analysis area where we do all of the testing on the blood. And then there's that surgical pathology area that I mentioned where the doctors are, the pathologists. All laboratory testing is associated with one of these two areas. So the similar tests are grouped into departments and the goal is to perform things accurately, efficiently, and cost effectively. So these are the areas that you'll see within the medical laboratory. And I just mentioned them all very briefly, but you're going to have to know the differences between them. These will show up on your test. Okay. Hematology is where we look at blood. We do blood counts and we look at blood forming tissues such as bone marrow. Coagulation is where we look at the ability of the blood to form and dissolve clots. Okay. A lot of people's grandmothers, grandpas are on Coumadin, which is a blood thinner. We need to make sure they're not taking too much so that they bleed all over, or they're not taking too little that they throw a clot. In chemistry, we do lab tests, glucose, electrolytes, drug testing, things like that. Serology and immunology, we look at your immune system. Urinalysis, we look at urine. Microbiology, we look at bacteria. We grow the bacteria and we tell the physician what type of antibiotic will kill that particular bacteria. And blood bank, or immunohematology, it's the same word. This is where we work with the blood that we transfuse to patients. So blood can't just be taken out of a refrigerator and given to a patient like it is on Grey's Anatomy. We do have to do additional antibody screening to make sure that that blood is appropriate for that patient. In this anatomical and surgical pathology area, there's 3 subspecialties within that. So this is kind of the doctor's doctor. He tells the doctor if there's anything that might be cancerous. Histology is where we look at the tissues. You can see the man down here in the bottom looking at the cross-section of something that might be a kidney. Cytology is the structure of the cells. So pap smears that women have every year, cytologists would be looking at those. Cytogenetics, we can look at chromosomal deficiencies and genetic disease to see if a patient or a baby might have some certain type of a disease. We have some different types of labs. So stat labs are in tertiary care facilities. Think hospital laboratory. They're located very close to the emergency room, usually somewhere between emergency room and surgery and the ICU departments, so that they can get labs there quickly and get results very quickly. There's also reference laboratories. These are large independent labs. Think Mayo Clinic, Marshfield. They have these huge laboratories that perform tons and tons of testing. They can receive specimens from outside of the state even. There's some laboratory samples that, being the part-time job I work at, that we send to, some we send to Virginia. There's some that get sent to San Juan Capistrano, California, depending on how specialized those tests are. Here's a picture of an analyzer that somebody might be using in the chemistry department. This is the Cobas 6000 chemistry analyzer. It can perform many, many laboratory tests in a very quick period of time. So as you can see, even though we have analyzers, there are techs that are required to know exactly how this analyzer works and know what every test is and what disease processes go with each of those tests. The biggest piece is quality control. Is the thing working? So let's look at the different clinical laboratory personnel. You guys have learned what a phlebotomist is, that they draw blood. The next is the laboratory director or pathologist. They manage the lab. They're usually a pathologist or a clinical lab scientist. A pathologist is the person who specializes in diagnosing disease. So they might get the tissue or the cancer removed from the patient. They're able to look at that and tell the doctor, yes, they do have cancer, or no, they don't. There'll be a laboratory manager. They usually have an advanced degree. They oversee all the operations involving the physician and patient services, and they can also sometimes supervise the ancillary services, such as radiology and respiratory therapy. The next one would be a technical supervisor. They administer a lab section or subsection, so they might manage hematology or chemistry or blood bank, something like that. They do usually have an additional education in some type of clinical lab area. For example, I have a specialization degree in clinical chemistry. So when I worked in the laboratory, I did work a lot with the clinical chemistry. I've been teaching clinical chemistry, so that would be an area that I could be a technical supervisor in. We have medical technologists and medical laboratory scientists. They typically have a bachelor degree. So they have gone for an MLT degree, which we'll talk about in a minute. So they could have gotten an MLT degree and then gone for 2 more years to be an MT. But most of them typically go to a UW school. UW Oshkosh, UW Stevens Point are just 2 examples of 4-year colleges that have a degree in medical technology. We perform all levels of testing in any area of the lab and report the results. We have to perform quality control, evaluate new procedures, and maintain those instruments to make sure everything that is reported is accurate. I am a medical technologist. That's what my degree is in. So here's an example of another analyzer we might see in the medical laboratory. This person is loading an Iris automated urine analyzer. So we're able to take a urine, put it in an analyzer. It will tell us if there's anything wrong with it, if the patient's got diabetes, liver failure, kidney failure, infections. It will also tell us what type of cells might be present as well. So we still have to know how to do it by hand, but we have analyzers that do it for us. The medical laboratory technician has a 2-year associate's degree. We do have this program at Fox Valley Technical College, and some of you are actually in this program. It's an associate's degree that performs routine testing, operates and maintains all equipment. Sorry. This degree you can go from this degree to get the bachelor's degree, is what I should say. There's a lot of science, there's chemistry, biochemistry, and things like that you have to take prior to getting into the medical laboratory technician program, but there is a huge need for MLTs or medical lab techs in the Fox Valley right now, and it's actually quite a scary shortage. So if you're considering going on from being a phlebotomist, highly recommend this one. Clinical laboratory assistant is a phlebotomist who has some extra training in laboratory testing. There are certain types of CLIA waived tests that a clinical lab assistant could perform. They can also help prepare samples as well. This person on the right is running a hematology analyzer that counts blood cells. Then there's a phlebotomist. Everybody's familiar with that because you're all taking the course or will be taking the course. They collect blood for lab tests for diagnosis and care of patients. They serve in the role of lab assistant or specimen processor. There's formal programs that usually require a high school diploma or equivalent to enroll. So most of you are, in the program here. Other laboratory personnel, we have computer programmers, laboratory information system managers, quality assurance managers, point of care coordinators. So there's other people that work within the laboratory. So people often don't think of the laboratory, but there's quite a few staff back there. So one of the last things I'm going to talk about is the Clinical Laboratory Improvement Act. This allows regulation of all sites performing lab testing in the United States. So for example, I cannot go to Fox River Mall and open a kiosk to do laboratory testing to raise money or to make money. I would have to have a CLIA certificate that shows we're doing things safely and accurately with no detriment to the patient. Okay. There's requirements. You must have a laboratory director, a technical consultant, supervisors, and testing personnel that are trained. So CLIA assures that all labs are doing things appropriately. All right, so that is the end of our presentation for Chapter 1. Make sure that you go ahead and look at some of the additional assignments within this week's within this week because we do have only a virtual class this week. So I'll have additional assignments in there for you.